I would like to invite you to continue to work together, amongst yourselves and hopefully with us to improve healthcare access and health equity for immigrant Latino adults. This work done by many of you obviously preceded the creation of Centro SOL, but we hope to contribute to further progress. Please feel free to send us suggestions and concerns, and please expect to hear from us. Next we will hear from Michelle LaRue. I will not reintroduce her as she was with us earlier today. She's with CASA, and she's going to speak on Maryland's path to universal health care. And then Charlie Royland will provide some closing remarks. Charlie, since 2009, has been Executive Vice President and Chief Operating Officer at the Johns Hopkins Bayview Medical Center. In this role, he provides leadership for the executive team relating to all hospital operations which impact patient care and advances the medical center's efforts in its own sort of development. He has a lot of perspective on the healthcare landscape in Maryland through his involvement with the Maryland Hospital Association and the HSCRC, as well as Priority Partners, which is a local MCO. We have been lucky to have convinced him of the role that we hope Centro SOL will be able to play, and the important and beneficial presence of many Latinos in the Southeast Baltimore Bayview's neighborhood. So he's been an early supporter of Centro SOL and really helped us get launched. So thanks to both of you.
It's been a long day. I just wanted to share an exciting thing that we decided to take on as CASA. After working with the ACA and really seeing where all the gaps are and seeing some other programs, we decided to see about studying the idea of universal health care for Maryland. So just to give you quick background, sí se puede. With everything that we've been doing in the recent years, between the DREAM Act and getting driver's licenses again for the undocumented, with the ACA, CASA and other community partners has done a lot to help the Latino community really take advantage of having health coverage. And for many of our community, it is the first time they ever have health coverage, so a lot goes into that. But just also the emphasis on health and wellness through the health enterprise zones, the robust community health worker models that are being used across the country and across Maryland, more emphasis on health literacy. We really see that this is the time to do it and to keep the momentum going. So since the ACA, the coverage gap has decreased quite a bit, but obviously there's still a lot of work to be done. Close to 130,000 are still ineligible and are still uninsured. So this is really who we're trying to focus. We've been focusing on enrolling in the ACA for the last couple of years, and we really would like to expand those services. So the ACA specifically disqualifies all undocumented from any kind of health coverage, even from buying even at full price with no subsidies through the exchange. So we decided to, and that includes DACA, DAPA, and TPS is not included in that. I mean, TPS does qualify for qualified health plans, but we have found that working with this community, even within MHBE, they don't know what to do. There's just a lot of glitches. They really need a lot more training on immigration policies. But we really would like to see this expanded a lot more to include these populations in the future. So we decided to cross-file 2 bills in the state and House in Annapolis. As you can see, these are all the different steps. We worked really hard to get it through. It did actually pass in the Senate. It had multiple supports on both sides. Unfortunately, in the Senate, when it passed over, Centro SOL stepped in and was really gracious to want to work with us to do this study. Let me take a step back before I get through all the things. What the bill was about was to create a task force to take the first steps in looking at universal health care in Maryland by studying who are exactly all the underinsured and uninsured populations in Maryland, and how much really, what are the cost estimates of expanding healthcare coverage to all Maryland residents. So that was what we were proposing. It's just a 2-year study. We were cross-filing, like I said, in both the House and the Senate. It did pass in the Senate, but when it passed in the Senate, they really wanted MHBE to take charge. Unfortunately, this didn't really quite work out because MHBE then threw on a very high sticker price onto it, and we're saying that the task force, a 2-year task force, would cost about $500,000, and we knew that that wasn't the case. So throughout this process, though, we made some great partnerships. Like I said, Centro SOL was nice enough to, at one point, volunteer to be the entity that the task force would be run through until MHBE came into the mix. However, like I was mentioning, we did get so much support from the leadership in both the Senate and the House that even though it was pulled from the floor due to the sticker, the price tag, we are still moving forward, and the study will still be done through Hopkins, and we're still moving in the right direction, at least. So again, what the task force is tasked to do is to study exactly what are the populations that are underserved and unserved through the ACA currently, who's not getting any coverage, looking at a healthcare for all. And I won't go into a lot of the details because I know we've already heard from other speakers, but it would be something similar to looking at, would something like Montgomery Cares be an appropriate model across the state, or some other options, but really getting from this study recommendations as well as cost estimates about being able to apply something like that statewide. And that's it in a nutshell.